study was a review of national and state level guidelines, particularly looking at equianalgesic dose recommendations across guidelines. We looked at both dose conversion factors as well as patient factors that should be considered at the time of conversion. In addition, we looked at the data sources that underlie these recommendations across the different national and state guidelines and the degree of consistency across these guidelines. So the fact that most of the dose conversion studies that led to the national guidelines, particularly the primary clinical studies that were conducted mostly in the 1990s, very small patient populations, conducted with just a single dose. It's important that both healthcare professionals as well as policymakers understand the limitation when applying these studies as primary sources for patients in a chronic pain setting. So it's important to understand that although several guidelines do contain a table with particular conversion rates between morphine or another opioid, it's also important to consider patient factors such as whether the patient's elderly, whether they have other comorbid conditions or are taking other medications that could influence how the drug is used in the body. We did anticipate that there was, or from our background knowledge, we did think that there was some variability across the conversion doses, but what we were really surprised about was the variability in data sources that underlie these recommendations across national guidelines, across professional societies, across government recommendations. So there is differences in publication type, whether it was a clinical study or an opinion. There were differences in the age of the data. In some cases, the guidelines that were referred to as a reference were withdrawn or superseded by the society that put them forth. Well, part of the purpose of this poster was to raise awareness about the variability, and we're not making a recommendation as to which guidelines should be followed, but really raising the opportunity to do more research, particularly in a chronic pain setting, that can help us to better understand the conversion between opioids.